As we age, our eyes, like the rest of our body, undergo natural changes. You might notice that reading small print becomes harder, colors seem less vibrant, or your eyes feel drier than they used to. These shifts are common, but that doesn't mean you have to accept declining vision as inevitable. The right nutrients can play a powerful role in maintaining and even improving your eye health well into your golden years. Age-related eye conditions, such as cataracts, macular degeneration, and glaucoma, are leading causes of vision loss in seniors. But here's the good news. Research shows that certain vitamins, minerals, and antioxidants can slow down these processes and protect your eyes from further damage. The key is knowing which supplements are most effective and how to incorporate them into your daily routine safely. You might already be familiar with the importance of carrots for vision, thanks to their beta-carotene content. But eye health goes far beyond just one vegetable. A combination of vitamins A, C, E, omega-3 fatty acids, lutein, zeaxanthin, and zinc works synergistically to shield your eyes from oxidative stress, inflammation, and light-induced damage. The right balance of these nutrients can help preserve sharp vision, enhance night sight, and reduce discomfort from dryness. In this guide, we'll walk through the top eye health supplements for seniors, explaining how each one works, the best food sources, and what to look for in a high-quality supplement. Whether you're dealing with early signs of vision decline or simply want to take a proactive approach, understanding these key nutrients will empower you to make informed choices for long-term eye wellness. Let's start by exploring the most critical nutrients your eyes need and why they matter. Now that we've established why eye health deserves your attention as you age, let's explore the specific nutrients that act as your eye's first line of defense. Think of these compounds as your vision's personal bodyguards. Each plays a unique role in protecting against different threats, from harmful light waves to cellular damage. At the top of the list are lutein and zeaxanthin, often called the eye vitamins. These powerful carotenoids accumulate in your retina, particularly in the macula, the part responsible for sharp central vision. They function like natural sunglasses, filtering out damaging blue light from screens and sunlight while neutralizing free radicals that accelerate aging. Studies show seniors with higher levels of these pigments have up to a 40% lower risk of advanced macular degeneration. Next, omega-3 fatty acids, specifically DHA and EPA, serve as essential building blocks for retinal cells. DHA makes up nearly 60% of the fatty acids in your retina, maintaining cell membrane fluidity for optimal visual signaling. Meanwhile, EPA reduces inflammation that contributes to dry eye syndrome, a condition affecting over 30% of older adults. Don't overlook vitamin A, the nutrient most famously tied to vision. It produces rhodopsin, a pigment in your rods, low-light receptors, that prevents night blindness, a common complaint among seniors struggling with dim lighting. Without adequate vitamin A, your eyes can't properly moisturize themselves, leading to corneal ulcers in severe cases. Antioxidant heavyweights vitamins C and E work as a team to combat oxidative stress, which clouds the lens, causing cataracts, and damages delicate retinal tissues. Vitamin C also regenerates vitamin E, creating a protective cycle. Then there's zinc, the gatekeeper that transports vitamin A from your liver to your retina, while bolstering immune defenses against eye infections. Each of these nutrients operates like a specialized worker in a finely tuned factory. When one is deficient, the entire system becomes vulnerable. In the next sections, we'll examine each player in depth, starting with vitamin A's critical role in keeping your vision sharp after sundown. You've likely heard that carrots are good for your eyes, but do you know why? The credit goes to vitamin A, a fat-soluble nutrient that serves as the cornerstone of night vision and corneal health. As we age, our bodies become less efficient at absorbing and converting vitamin A, making supplementation increasingly important. For seniors, let's break down how this powerhouse nutrient works. Inside your retina, vitamin A transforms into retinol, a key component of rhodopsin, the light-sensitive pigment in your rod cells. These cells act as your night vision cameras, allowing you to discern shapes and movement in low light. When vitamin A levels dip, rhodopsin production slows, leading to nyctalopia, night blindness. You might notice it takes longer to adjust when moving from bright to dark spaces, or that driving at dusk becomes dangerously challenging. But vitamin A's job doesn't stop there. It also maintains your corneal epithelium, the eye's outermost protective layer. Without sufficient vitamin A, this layer can keratinize, harden, causing xerophthalmia, a condition marked by dryness, ulceration, and in severe cases, irreversible blindness. Early signs include bitose spots, foamy patches on the conjunctiva, and a gritty sensation akin to sand in your eyes. Getting the right form. Not all vitamin A is created equal. There are two primary forms. Preformed vitamin A, retinol, retinoic acid. Found in animal products like liver, eggs, and dairy, this active form is readily used by your body. Provitamin A, carotenoids, beta-carotene. Plant-based sources, like carrots, sweet potatoes, and spinach, must be converted to retinol in your gut. For seniors, preformed vitamin A is often more effective due to age-related declines in conversion efficiency. However, excessive intake, over 10,000 IU/day from supplements, can cause toxicity, manifesting as dizziness or liver stress. Beta-carotene is safer at higher doses since your body only converts what it needs. Smart supplementation. Dosage. The RDA for senior men is 900 mcg RA, 3,000 IU, and 700 mcg RA, 2,300 IU, for women. Up next, we'll explore how omega-3s tackle the pervasive issue of dry eyes, a problem affecting nearly 1 in 3 seniors. If you're part of the 30% of seniors who experience persistent dryness, itching, or a burning sensation in your eyes, the solution might lie in your omega-3 intake. These essential fatty acids, particularly EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, act as natural lubricants and inflammation regulators for your eyes. But as we age, our bodies become less efficient at converting plant-based omega-3s, ALA, into these active forms, making direct sources or supplements crucial. How omega-3s combat dry eye syndrome. Dry eye disease occurs when your meibomian glands, tiny oil-producing glands along your eyelids, malfunction, leading to rapid tear evaporation. Omega-3s address this in 3 ways. Stabilizing. Tear film. They improve the oily layer of tears, preventing them from evaporating too quickly. Reducing inflammation. EPA suppresses inflammatory cytokines that cause gland blockages, a major contributor to dryness, supporting corneal. Healing. DHA enhances cell membrane health, aiding recovery from irritation caused by chronic dryness. Clinical studies show seniors taking 1,000, $2,000 milligrams daily of combined EPA-DHA experience significant relief within 8 to 12 weeks, with some able to reduce reliance on artificial tears. Choosing the right source. Not all omega-3 supplements are equally effective. Here's what to look for. Fish oil. Opt for triglyceride form oils, not ethyl esters, for better absorption. Wild-caught salmon or sardine oils are ideal. Algal oil, a vegan alternative rich in preformed DHA, bypassing conversion issues. Avoid low-quality oils. Cheap supplements may contain rancid fats or insufficient EPA-DHA ratios. Aim for at least 3:2 EPA-DHA. Practical tips. Dosage. Start with 1,000 milligrams EPA plus DHA daily. Increase to $2,000 mir if dryness persists. Consult your doctor if on blood thinners. Synergy. Pair omega-3s with vitamin E, section 6, to prevent oxidation of these delicate fats. Dietary boost. Eat fatty fish, salmon, mackerel, twice weekly, or add flax seeds, for ALA, to smoothies. Imagine your eyes having their own built-in sunglasses. That's essentially what lutein and zeaxanthin provide. These two powerful carotenoids concentrate in your macula, the central part of your retina, forming what scientists call the macular pigment. This golden yellow pigment acts as a natural filter against harmful high-energy blue light from screens, sunlight, and LED lighting. As we age, this protective pigment naturally thins, leaving retinal cells vulnerable to phototoxic damage. Research shows seniors with higher macular pigment density have 41% lower risk of advanced macular degeneration, AREDS 2 study. Better contrast sensitivity, critical for night driving. Reduced glare recovery time, important when transitioning between light conditions. How these nutrients, lutein and zeaxanthin, operate through three key mechanisms. Blue light absorption. They absorb 40 to 90% of incident blue light before it can reach delicate photoreceptors, antioxidant defense. They neutralize free radicals generated by light exposure structural support. They help maintain retinal cell membrane integrity, optimizing your intake. The body doesn't produce these compounds. You must get them through. Diet: kale, spinach, and egg yolks. Zeaxanthin is particularly abundant in eggs. Supplements: look for products containing both nutrients in a 5:1 ratio, 10 mg lutein, 2 mg zeaxanthin is common. Important note: these carotenoids are fat-soluble. Taking them with a meal containing healthy fats, like avocado or olive oil, can boost absorption by up to 300%. Special considerations for seniors: cataract prevention. Studies show 6 mg daily of lutein reduces cataract surgery risk by 32%. Dosage: the AREDS 2 formulation recommends 10 mg lutein plus 2 mg zeaxanthin daily for at-risk individuals. Bioavailability: free forms, not esterified, are absorbed better, especially important for those with digestive issues. Your eyes operate in one of the most oxygen-rich environments in your body, making them particularly vulnerable to oxidative stress. This is where vitamin C and E step in as the ultimate antioxidant team, working together to neutralize free radicals before they can damage delicate eye tissues. The antioxidant power couple. These vitamins don't just work side by side, they constantly regenerate each other in a protective cycle. Vitamin E, alpha tocopherol, is fat-soluble, embedding itself in cell membranes to stop lipid peroxidation, a chain reaction that damages retinal cells. Vitamin C, ascorbic acid, is water-soluble, mopping up free radicals in ocular fluids while also recharging oxidized vitamin E. This partnership is especially crucial for preventing cataracts. Oxidative damage clouds the lens over time. Studies show seniors with high vitamin C intake have a 33% lower risk of cataract progression. Macular degeneration. The retina's high metabolic activity generates free radicals that vitamins C and E help neutralize. Diabetic retinopathy. By reducing vascular inflammation, this duo helps protect fragile retinal blood vessels. Optimal forms and dosages. Not all supplements are equally effective. For maximum benefit, vitamin C, look for buffered forms, calcium ascorbate, liposomal C, to avoid stomach upset. Dose: 250, 500 ml day. Higher doses may be excreted unused. Food sources: bell peppers, citrus, broccoli. Vitamin E. Choose mixed tocopherols, not just alpha tocopherol, for full spectrum protection. Dose: 100 to 400 IU day. Avoid exceeding without medical supervision. Food sources: almonds, sunflower seeds, spinach. Synergistic combinations boost effectiveness by pairing with zinc. Helps vitamin A recycling, covered in Section 7. Omega-3s. Vitamin E prevents their oxidation in the body. Lutein. Vitamin C enhances its absorption. Pro tip: if you take blood thinners, Consult your doctor before increasing vitamin E intake, as high doses may affect clotting. While flashier nutrients like vitamin A and omega-3s often steal the spotlight, zinc quietly serves as the indispensable conductor of your eye's nutritional orchestra. This trace mineral participates in over 100 enzymatic reactions in ocular tissues, making it fundamental for both preventive and restorative eye care in seniors. Zinc's critical roles in vision. Vitamin A's chauffeur zinc enables the liver to release stored vitamin A, then transports it to the retina where it's converted to protective pigments. Without adequate zinc, even sufficient vitamin A intake becomes ineffective, like having fuel but no delivery truck. Macular degeneration. Defense: the macula contains the highest zinc concentration of any eye tissue. Here, it stabilizes cell membranes against oxidative damage, regulates the inflammatory response implicated in AMD progression, preserves photoreceptor function. AREDS studies showed 25% risk reduction with zinc supplementation. Night vision, support zinc dependent. Enzymes facilitate rhodopsin regeneration, the visual pigment critical for low light adaptation. Seniors with zinc deficiency often report delayed dark adaptation. Special considerations for older adults: absorption challenges. After age 60, zinc absorption decreases by 20–30% due to reduced stomach acid production, common medication interactions, PPIs, diuretics. Competition from calcium, iron supplements, optimal supplementation form. Matters: choose zinc picolinate or methionine for superior absorption over oxide forms. Dosage: 25–40 bases ml/day day. Copper should be supplemented at 2 ml to prevent depletion. Timing: take with protein-rich meals to enhance uptake. Warning: signs of deficiency: poor wound healing, especially eyelid sores, altered taste perception, recurrent styes, conjunctivitis. Dietary synergies: pair zinc-rich foods, oysters, pumpkin seeds, with vitamin C, containing foods to enhance absorption. Animal proteins that provide zinc-binding amino acids. You might not immediately connect B vitamins with eye health, but these unsung heroes play a pivotal role in maintaining optimal blood flow to your optic nerve and retina. As we age, microcirculation naturally declines, depriving delicate eye tissues of oxygen and nutrients. This is where B9, folate, and B12, cobalamin, step in as critical defenders against vascular-related vision loss. Why B vitamins matter for senior eyes. Homocysteine regulation. Elevated homocysteine, a common issue in seniors, damages blood vessels and is linked to 42% higher risk of age-related macular degeneration, increased glaucoma progression rates, retinal vein occlusion susceptibility. B vitamins, especially B12 and folate, convert homocysteine into harmless byproducts, protecting your ocular microvasculature. Optic nerve preservation. The optic nerve requires constant energy supply. B12 deficiency can cause optic neuropathy, blurred vision, reduced color perception, pseudotumor cerebri, increased intracranial pressure affecting vision. Glaucoma risk reduction, improved circulation helps regulate intraocular pressure. Studies show seniors with high B12 levels have 30% slower visual field loss in glaucoma. Better responsiveness to glaucoma medications. Supplementation strategies forms that work: methylcobalamin, not cyanocobalamin. The active B12 form that bypasses absorption issues, methylfolate, critical for those with MTHFR gene mutations affecting 40% of population. Optimal dosages: B12, 500–1,000 mcg daily. Sublingual preferred for seniors with absorption issues. Folate, 400–800 mcg DFE, dietary folate equivalents. B-complex includes B6, which works synergistically. Absorption boosters. Take with a protein-rich meal. Avoid concurrent calcium supplements, which can inhibit B12 absorption. Warning: signs of deficiency: unexplained blurred vision, snowy, visual field disturbances, burning sensation in eyes. With so many eye health supplements on the market, choosing the right one can feel overwhelming. Should you take individual nutrients or opt for a comprehensive formula? Let's break down the pros, cons, and key differentiators of combination. Supplements specifically designed for senior eye health. What makes a quality eye health formula? The best supplements should include research-backed doses of AREDS2-based nutrients, lutein, 10 mg, zeaxanthin, 2 mg, vitamin C, 500 mg, vitamin E, 400 IU, zinc, 25 mg, copper, 2 mg. Added support, omega-3s, 500 mg, DHA, EPA, vitamin D3, 1000 IU, bilberry extract, 120 mg, bioavailable forms, methylcobalamin, B12, pyridoxal 5-phosphate, B6, and zinc picolinate comparing popular formulas 1. Preservision AREDS2 Pros. Gold standard formula used in NIH clinical trials, cons. Contains beta-carotene, risky for smokers, large soft gels too. Macu Health with LMZ3 Pros. Triple carotenoid formula, lutein, zeaxanthin, mesozeaxanthin. Cons. Expensive, lacks other AREDS2 components. Nature-made vision, AREDS2. Plus. Multivitamin Pros. Combines eye nutrients with basic multivitamin. Cons. Lower lutein, zeaxanthin than standalone formulas, customizing your approach for early prevention, 60-70 YORs. Moderate dose lutein, zeaxanthin, 5 to 10 mg. Added omega-3s for dry eye relief for existing conditions, 70+ ORS. Full AREDS2 doses. Additional bilberry for capillary strengthening. For vegetarians, special diets. Algal DHA instead of fish oil. Methylcobalamin, B12 Pro. Tip: look for NSF or USP certification to avoid contaminants common in eye supplements. Now that we've explored all the key nutrients, it's time to craft a plan that fits your specific vision concerns, health status, and lifestyle. Remember, even the best supplements work best when strategically combined with dietary and lifestyle adjustments. Step-by-step personalization. Assess your risk factors. Family history of AMD or glaucoma. Prioritize AREDS2 formula plus omega-3s. Diabetes or hypertension, focus on B vitamins plus vitamin C for vascular support. Dry eye symptoms? Increase EPA, DHA to 2,000 mg daily too. Medication interactions. Blood thinners, limit vitamin E to 100 IU. Diuretics, increase zinc, magnesium intake. PPIs, require methylcobalamin B123, budget-friendly options. Start with standalone lutein, zeaxanthin. Fearless multivitamin. Add omega-3s from affordable sardines or algae 4. Synergistic lifestyle habits. Wear blue-blocking glasses after dusk. Practice the 20-20-20 rule. Every 20 mins, look 20 feet away for 20 sec. Increase dietary sources. 2 servings, leafy greens, plus 1 Oz nuts, daily, 5. Monitoring, progress. Track visual changes with an Amsler grid. Get annual macular pigment optical density tests. Reassess supplements with your ophthalmologist every 2 years. Final checklist before starting. Review current medications with pharmacist. Choose certified supplements, USP, NSF. Start 1 new supplement at a time, 2-week intervals. Schedule baseline eye exam. You've gained what many seniors never learn, the power to actively protect your vision through targeted nutrition. Remember that. Small daily actions create compounding benefits. It's never too late to start supporting your eye health. Consistency matters more than perfection. Your next steps. Bookmark this guide for reference. Share it with a friend who values their vision. Subscribe to our newsletter for health tips. Schedule that eye exam you've been postponing. Thank you for investing this time in your visual future. Here's to seeing life's beautiful details for many years to come.